Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Gapuz, joining you for another teaching and learning session. This time around for Pointers 5 for the next generation NCLEX. But before we move on to our pointers for this session, those of you who may want to check on my old videos, they are still relevant, especially the quick fix sessions that we have still in this channel. Please do check them out before proceeding with our pointers and tips. So here we go. Before we proceed with our discussion and of course the presentation of our pointers, set number 5, let me first greet our hazard for the Dubai Health Authority. He's now a registered nurse in the Middle East. Congratulations, Sir Jeffrey B. Medina, DHARN, who passed the test. Last May 5, you deserve a salute from our group. Congratulations. And he actually got into our online class. And of course, we have another passer here. This time around, we have Madame Aziel Grace Aguilar, who's a registered now, both in the Philippines and in the US, USRN. Another salute. So this is what she has to say. What prepared her to pass the next generation NCLEX RN? So let's read through her advice. I was given a month to focus for my NCLEX, and in such a short time, I'm glad I grabbed the chance to attend the 10-day face-to-face Next Gen Bootcamp in Baguio. That was very recent. That was April 10 to 20. And I am the exclusive facilitator of that bootcamp. We had really a great time. And the 3-day quick fix via online, April 23 to 25. I do conduct a quick fix either face-to-face here at second floor of the Gapuz building, Ray Gapuz building here in Yun Avenue, Manila. And you can just inquire how to join. It's usually free for all our nurses in the Ray Gapuz system. 2 days before the exam, I all spent the time reading NCLEX 311. That's my book. It's also being sold at Amazon. You may want to check. The international title is NCLEX RN in a Flash by Ray Gapuz. Definitely published by Jones and Bartlett USA. And I watch videos from the core shells, specifically the Pecha Kucha by Sir Ray, my favorite. Well, she likes Pecha Kucha. It's a methodology in which we're able to talk about 20 concepts in 6 minutes, 40 seconds. That's 20 seconds per concept. And that's a very good way of summarizing the things that you need to remember for your test. So the core shells, these are available here at the Ray Gapuz system. You can have unlimited access for only $149. And it has the Q bank, it has instructional videos, it has all the things you need to pass the test. I've learned a lot of functional concepts, and thinking syndromic helped me as well. Syndromic thinking is the main strategy for the next generation NCLEX RN. Okay, I really believe that it was you, Ray A. Gapuz Review System, who helped me deal with the new generation NCLEX, and I'm beyond grateful to God that I have known you in this journey. And she capped her testimonial with Ukinam. That's an Ilocano word of endearment. It's actually curse, but we turned it into a word of endearment every time we get to see each other and bump into each other during the bootcamp session. My hats off to you, Madam Aziel Grace Aguilar, who's now a USRN. Congratulations. Okay, be a USRN. Join our thousands of passers worldwide, not just in the Philippines, who believe in the Ray Gapuz system. So give us a text or a call, 0906 201 9383, or send us an email at info@ragapuzreview.com. So let's talk about our NGN pointers. First and foremost, what are the things that I want you to focus on while studying for the next generation NCLEX? The first one is definitely gout. Now, pay particular attention to the fact that gout is a form of inflammatory arthritis, and as such, it usually affects the joint. So specifically, it affects the great big toe. Now, this type of arthritis is due to hyperuricemia, meaning there's an elevation of uric acid. Take note, there is no cure for gout. The medications that are given are just meant to relieve the symptoms. Okay, so what are the things that I'd like you to remember related to gout? First and foremost, look for the defining characteristics of gout. So remember PRS, when you see pain, redness, and swelling of the great big toe, that should give you the go signal to think that chances are the case could be gout. Now, this could be related to case studies that you will find in the test. Now, another thing that you have to focus on will be the risk factors. Remember, gout is more common in males. So remember, the common risk factors would be DON, not dirty old man, but D, meaning to say you have diet that is high in uric acid or high in purine. So that includes your organ meats. And then another D would be having diabetes mellitus and other medical conditions. And D, drinking alcohol. So you have three important things on letter D. So diet that's high in uric acid or purine, diabetes mellitus, and drinking alcohol. And then O, you have obese, and M, male. So DOM. Now, there are two types of gout. You have the acute gout and chronic gout. And when there is acute gout, your priority should be to administer the medications that will relieve inflammation and pain. And you have three types of medications that could be given potentially. You have your non-steroidal anti-inflammatory agent. An example would be your ibuprofen. Now, what do I want you to remember about ibuprofen? Take note. It is best given with meals, or if you don't have that in the option, after meals. And if you have both in the option, it is best to answer it's best given with meals. Next, you have the drug colchicine, which decreases the inflammation in the joints. Now take note that it can be taken with or without food. And stop taking colchicine. Tell your patient to stop taking it when they are relieved of their pain. In other words, there's no more pain, or when they're experiencing NVD, nausea, vomiting, and diarrhea. They have to report it to their physician. And of course, the third for medication for acute gout would be your corticosteroid. And this is usually injected to the patient. Now, when a patient has chronic gout, there's a combination of two medications that are given to the patient. We have the code PA. So first, we have probenecid, which could be taken with or without food. And the main action of probenecid is it promotes excretion of uric acid. Now, the drug that is given in combination with probenecid would be your allopurinol. Now, take note that allopurinol prevents the production of urate. So that's the difference. Probenecid promotes the excretion of uric acid. Allopurinol prevents the production of urate or uric acid. Now, take note that both drugs can be given with or without food. However, since allopurinol has strong side effects related to the gastrointestinal tract, it is best taken after meals. So your allopurinol is best taken after meals. Okay. Now, the second thing that I'd like you to remember about your preparations for the NCLEX would be acute pancreatitis. Now, take note when you say acute pancreatitis, that usually involves inflammation of the pancreas. Now, since this is just an acute inflammation of the pancreas, this condition would usually last for a week. And oftentimes, this is associated with three common risk factors. First, the presence of gallstone or cholelithiasis. So you may want to find out in the history of the patient if the patient had gallstones or still has gallstones. Second would be drinking alcohol. So gallstone plus alcoholism plus periumbilical pain. Think about the syndrome that you will find in acute pancreatitis. And this is also associated with smoking. Now, what would tell you that the patient is having pancreatitis? Remember, since this is an inflammatory condition, you have fever, and then your NVDJT. N, nausea, V, vomiting, D, diarrhea, and then jaundice and tenderness. So create a story. Patient had gallstone, patient is drinking alcohol, and is a smoker. And then all of a sudden, the patient had fever, and then there's jaundice, and then there's nausea, vomiting, diarrhea, plus tenderness in the abdominal or tummy area. So that defines that your patient could be having acute pancreatitis. Now, remember the functional concept. Whenever you have inflammation, the priority should be to promote rest of that specific organ that is affected by the inflammation. So in this case, how do you promote rest for the pancreas? keep the patient NPO, because we all know for a fact that pancreas secretes your enzymes that aids in digestion. So keeping the patient NPO will not overwork the pancreas. And after that, infusion of IV fluids would be an appropriate intervention. Now, since your pancreatitis would usually involve the presence of periumbilical pain, which could potentially become severe. So it's very important that pain medications are available for the patient. So morphine is given to the patient. Now remember, in old literatures, they were saying that morphine could potentially increase the pain because it increases the spasm of the sphincter of Oddi. Recent evidence suggests, does not point out to morphine. The evidence actually suggests that it could be related to codeine. So it is now codeine that can precipitate the increase in the spasm of the sphincter of Oddi, or it's now codeine that can potentially trigger acute pancreatitis. Now, which laboratory test will you check if your patient is having acute pancreatitis? Take note, the patient could be having elevated serum amylase and, of course, elevated cholesterol levels. Now, take note, your BUN and creatinine are associated with kidney conditions and not necessarily associated with acute pancreatitis. So pay particular attention to those things I'm highlighting because you need to remember them for your test. Okay. Now, the third is your RSV. This is known as your respiratory syncytial virus or the human orthopneumovirus. Now, this virus could potentially cause bronchiolitis, which is usually commonly affecting children. Now, how is this virus transmitted? It could be transmitted by coughing, sneezing, touching doorknobs, as well as toys. Therefore, children who are in the playroom could very well get this virus from the toys that they're playing when these toys are also being used by other children. Now, take note, since a lot of nurses think this is respiratory syncytial virus, they think that it is transmitted through droplet infection. No, okay? It does not necessarily mean that since it's transmitted by droplet, that you will have to implement droplet precautions. No, 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 okay? You will have to implement, according to the Centers for Disease Control, contact precautions, which simply means you will have to provide the patient with a private room, and then you have to use gloves and gown when interacting with the patient. Take note, even this is respiratory syncytial virus, you will have to implement contact precautions. Now, what would tell you what syndrome? Remember, syndromic is the kind of thinking that you have to have for the test. What syndrome or group of symptoms would tell you that the patient's having RSV or respiratory syncytial virus? Remember, RSV, runny nose and fever, sneezing, and vigorous wheezing or coughing. Once again, R, runny nose and fever, S, sneezing, V, vigorous wheezing and coughing. Now, take note, since this is a viral infection, there's no specific treatment. The management would be symptomatic, which simply means we have to provide interventions for each specific symptom. So if the patient's having fever, then we'll have to give medications to decrease the fever. Example would be ibuprofen, which, remember, should be taken with meals. And of course, you will need to increase fluid. So take note, if your patient is having viral infection, it's very important that the treatment should be symptomatic. So it simply means you have to provide interventions for the symptoms that the patient is suffering from. Okay, so the second important pointer that I'd like to highlight from this set of pointers is you have to use the appropriate technology. Now, we're actually espousing or advocating for the Ray Gapuz core shells that contains 10 core shells to help you prepare for the different subjects like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation, and of course, your reduction of risk potential and psychosocial integrity. Okay, and the third and the most important thing, you have to be in a conducive environment. So this is how we usually conduct our classes. Okay, this is the Ray Gapuz NCLEX simulation room at the Ray Gapuz building, and this is how we usually conduct our quick fix sessions and our boot camps. And of course, if you may want to be a member of the successful class where almost 90% of those who are taking the program are passing the test, please do join us. And may I invite you now to avail of our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. It's your choice of live face-to-face class, live virtual class, on-demand and limited video recorded lessons. Wow. And the fee starts at 3,499. You are also given a Q bank and 3 books and next generation NCLEX strategies and sample questions by me. So quick fix sessions. These are the sessions that I conduct every month, okay, to give you a sense of focus. What do you need to remember days before your test? And of course, if you are a member or a part of a RayGapo system, you can join this repeatedly at no additional cost. So you have unlimited access of everything. So we have weekday schedule in the morning, weekday schedule in the afternoon, or even exclusive weekend classes. These are available. If you just have like 10 days of preparations, then you join me in my bootcamp. The next schedule would be July 24 to August 4. So send us an email, info@ragapusreview.com, or give us a call or a text at 0906-201-9383. I'll see you there. Once again, this is your mentor, your fact check buddy, Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. So take care until our next video.